Hi, this is Dr. Bolton. I'm here with a patient of ours, Mark. We're about to do a corrective surgery on him. Mark has a couple different things going on. First off, Mark got left with a very large scar in the suture area, the donor area, which I want to show you. Secondly, he has an unnatural growth of the grafts. He has some pitting. I want to point these out to the camera so the consumer knows what to look for. So let's take a look at the head here for a second. Okay, so this is a donor scar that Mark had from another doctor. He did not have this in our clinic here. And this is the scar that Mark was left with. Okay, as you can see, this is a very large, unsightly scar. Mark unfortunately cannot cut his hair short. Mark unfortunately cannot go into a pool without this being visible. If you look at the back of Mark's head, his previous physician used what's called a punch graft. A punch graft is what they use today to take out a follicular unit extraction. They punch a little hole out and they get the thing. These little pits that you're seeing here, this little pitting, is due to a punch graft that was made to use the slit to put it in. The technicians probably went too deep with the units. He's getting all sorts of ingrowns and breakouts due to that. You can see how their grafts are completely spacey. They don't blend in. They look like, you know, straws of hair sticking out of his head. So what we're going to do today is we're going to be camouflaging his existing work. We're going to block your eyes just so you know. This particular patient, these are his previous grafts up here. The natural hair went down. We've now created an alley between the grafts and the hair. So if you were to look at it from the other side, the same thing happened. The grafted hair stays, the natural hair goes, and then we create this alley. So we need to restore into the areas that don't have grafts to make sure in the event that natural hair goes down, it doesn't create something unnatural. So when we do the crown, we're going to recreate a nice natural looking spiral that blends in, that redirectionizes the hairs to get these hairs to relay. That's going to come on top and it's going to help fall, and then it's going to help cover this area. We're going to go through the front. We're going to soften the entire front up where we micrograft this with little one hair grafts, blend that in, make it super soft and natural so all of this blends in. And that's what we're going to be doing.